In this moment of division and polarization, there is one thing all Americans can agree on. The price of eggs are too darn high. The USDA says bird flu is to blame. In the last quarter of 2024, it's estimated more than 20 million chickens died in the epidemic. And that has cut the supply of eggs and driven up prices. That's all the supply and demand we learned about in school. Well, now the top health official in the Trump administration, Robert F. Kennedy Jr., is proposing a new approach that he says will lower prices. He wants to let bird flu run wild on farms and then see which birds survive and which ones die. In interviews, Kennedy has said this would enable people to identify and preserve the birds immune to the disease. To help us better understand these options, we are joined by CBS News medical contributor Dr. Celine Gounder, editor-at-large for public health at KFF Health News. She was also a member of the Biden-Harris Transition COVID-19 Advisory Board and is an infectious disease expert. So you are the person that we should be talking to about this. What are your thoughts on this new approach of basically letting bird flu do its thing, rip through American farms, and then see who survives?
Here's the problem with that. Bird flu is 100% lethal in our poultry. Our poultry are highly inbred. There is no genetic diversity. So you're not going to have some that survive, that develop immunity, and some that die. They're all going to die. And these deaths are really quite upsetting to workers. They're really inhumane. You get these birds that are twisting their necks around, kind of like in The Exorcist.
Oh.
It's really horrific to watch. And it's just not the right option to achieve what we're trying to achieve.
So Charles Darwin's theory of evolution, the survival of the fittest, won't work?
It won't work if you don't have genetic diversity. So if they're all genetically the same, they're all going to die.
What she's saying is we broke Darwin a long time ago in factory farms. So the alternative is culling. I don't really even understand how that works. How do they decide what to cull?
Well, if you have infections on, within a poultry flock, they're all going to die anyway. So the idea is cull them, kill them. And to get it over with as quickly as possible. This also makes more economic sense because instead of waiting for them to die off one by one, you just get it all done with one foul swoop. And then you can decontaminate and repopulate. You can't repopulate until they've all died off because otherwise if you introduce new chickens into that farm, they're all just going to get reinfected.
So any farms that have bird flu would just need to basically kill all the birds to have a clean slate and start over again?
That's exactly right. And there's a compensation program from the USDA that's been in existence for a few years now. So they are compensated for these losses and then they can move on.
Right, to help the whole system. But RFK Jr. surely knows that there isn't genetic diversity among birds. Why would he think that this idea of letting the strong survive work?
You'd have to ask him on that. Maybe he didn't take genetics in college. I don't know.
Or medical school. Oh, he's not a doctor. That's right.
I'd be curious to know. Okay, so when I buy a chicken at the grocery store, there's all kinds of writing on the package, and one of the things is often like no antibiotics. But would antibiotics actually help in this case? Could you treat some of these birds?
Well, there is discussion of using antiviral. So antibiotics are for bacteria, antivirals are for viruses. This was tried by the Chinese some 20 years ago. They used antivirals for the flu. What you ended up having was resistance developing to those antivirals. We don't use them anymore because they don't work for us anymore either. And so we have two antivirals. You may know them as Tamiflu and Xofluza. If those were used, there's no question you would just see resistance reemerge, and we would lose two of the really important tools we have to treat influenza in people.
Oh, wow.
Wow. So then best option, what should we be rooting for if we want lower prices for eggs at home?
Well, one dirty little secret is importation of eggs is very cheap. The eggs that you would be getting from places like Mexico and so on would be a lot cheaper than what our poultry farmers can provide here. No one wants to do that because that would be really damaging to our own industry. So if you really want to protect our own industry, it means addressing things like biosecurity measures. We think that the bird flu may also be transmitted airborne, so it's not just direct contact. That would mean things like airtight barns where the animals are being kept. That's very costly. And then other measures like vaccination, not just for animals, but for people. But we're not making the progress we need to be on those fronts.
On the vaccine?
Well, the Biden administration signed a contract for mRNA vaccines with Moderna late in that administration.
For bird flu?
For bird flu. And the Trump administration is now putting that on pause, reevaluating that. But that's one of the most important tools we have because mRNA vaccines, they may not be the most effective technology, but they are the fastest to produce.
Okay.
And so in a pandemic, they are by far your best option.
Thank you,
Dr. Gounder, thank you very much. Appreciate it.